When you hear the word hospice, a lot of times people think death, and they don't want any part of that. But when you list out what hospice does, all of those things are so profound. If I talk to someone and say, "Do you want hospice?" they may say, "No, I don't think we're ready for that yet." But if I say, "If you had a team that did all of these things," they say, "Yes, how do I get that?" That's hospice. Focus not to what hospice takes away, but what does hospice bring to the table?
Welcome to the Heart Hospice podcast, where compassion meets expertise and care goes beyond the expected. Here, we open the door to a world of understanding, where hospice care isn't just for the last moments of life, but is a journey of comfort, support, and dignity. On each episode, we'll dive deep into topics that matter most to patients, families, and communities, from the essentials of hospice care to the incredibly powerful stories that inspire Heart to Heart's exceptional mission. Founded on a commitment to holistic, patient-centered care, Heart to Heart Hospice stands apart as a privately held company that prioritizes compassion over profits, ensuring every patient receives the personalized attention they deserve. So whether you're here to understand more about hospice care, to support a loved one, or to learn about the impactful work behind the scenes, Heart to Heart Hospice is here to support you. Welcome to the Heart to Heart Hospice podcast.
Hello, listeners. This is MJ Durkin, the host of the Heart to Heart Hospice podcast. We have some really great information for you from a really great guest. She is a person who has been in the hospice industry, helping people with end-of-life issues for 25 years. She has 6 years of experience with Heart to Heart Hospice. Her name is Kelly Hampton. She is the community education representative. Kelly Hampton, how are you today?
I'm good. Good morning.
It's good to have you on the Heart to Heart Hospice podcast. And you are talking to us from Fort Worth, Texas today, right?
Yes, sir.
Excellent. Excellent. And Kelly, tell us a little bit about what your role is at Heart to Heart Hospice. What do you do on a daily basis?
So, in general, my job is to help educate families, patients, and staff at hospitals, physicians, nurses, nursing homes, assisted livings, anywhere someone may live or receive medical care that have questions about what does end of life care look like, palliative hospice, as people get their diagnosis, as their medical care increases. They have a lot of questions about what that looks like, what do next steps look like. And so I'm there to help answer questions, explain the services, sometimes just help navigate the medical healthcare system, which can be very convoluted. And so I can help answer those questions and then allow them to make the next best steps for them, whatever that may look like.
Excellent. Really well said. Very nice. I want everybody to understand that if you're listening to the Heart to Heart podcast, one of the things is that when these events happen to individuals and families, they are life shattering sometimes, most times. They are life changing, life shattering, I might say. And there's no courses on how to deal with end of life issues. Nobody wants to talk about death in America.
It's true.
Right? They don't want
Mhm.
to talk about it. They don't want to think about it personally. But I love the fact that you are educating the physicians, the nurses, people in nursing homes, the hospitals, assisted living staff. Talk to us a minute, because a lot of those kinds of folks will be listening to this podcast.
Mhm.
And the Heart to Heart Hospice podcast reaches all of the 4 states that Heart to Heart Hospice is in. What kind of things do you find that the doctors and the nurses and the hospital staff, nursing home staff, what are the things they're not sure about or they're concerned about? Tell us some of the issues that they're unclear about.
I think the biggest question that I get asked most often is, when do I utilize hospice? When is it time? I tell patients, families, physicians, you know, when someone has a chronic debilitating illness, generally in the later stages of that process. And it's hard to know when that happens because you've had COPD or CHF for years, and you've dealt with the symptoms that have exacerbated, and you've been in and out of the hospital. When those symptoms become more frequent, more often, more hospital visits. And when the aggressive treatments that are available don't seem to be helping as much as they did in the past, you're going to the hospital, but you're not getting the bounce back that you got before. That is when you start looking at what other options are available to me. If all I'm doing is going to the hospital to get symptom management, then can that be done in a different environment where I'm around my family versus sitting in the hospital for 2 weeks? And so, as you navigate kind of the healthcare system, which can be convoluted, most of the time people are wondering why hospice, why now? Because people often think of hospice as very end of life, as I'm dying, versus helping me continue to live well.
That's a very important distinction. I want all of our listeners to hear that. You mentioned COPD and another CHF, was
CHF.
it? Can you explain those to our listeners, what they mean?
Absolutely. CHF is congestive heart failure. And then just basically your heart muscle is not working as well as it used to. And so it's not pumping as well. And it creates all kinds of challenges. COPD, that is lungs. And I'm trying to think of what the acronym stands for, but it is your lungs aren't working. You're not able to breathe as well. And so those are two disease processes that tend to, over the course of time, become more symptomatic. You get them early on and you're able to manage the symptoms well. But as you get into the later stages, they become harder and harder to manage with more symptoms and more need for interventions.
Yeah. This is great information because my mom had COPD and struggled with her breathing. And I love what you said about if you're not getting the bounce back.
Mhm.
So, in the last 2 years of my mom's life, and she had a stroke and she had an amputation. She was 73 and a half or so when she passed. And she would have these bounce backs that would astound us. Like I would call my sister and say, I was looking in her eyes today in the hospital and it's coming. We're days away, right? And then I'd walk in 5 days later and she'd be like giving me orders and get my pictures over here on my stand and I want to see
Mhm.
my grandkids. And I was like, boy, she really had the bounce back confuses people, doesn't it?
It absolutely does. And I think it makes you second guess decisions that you're making. Is it time? What do we do next? And so, things can change from day to day, but definitely they kind of look for those disease progressions, the COPD, the CHF, some of those longer chronic debilitating illnesses over the course of time. There's kind of a stair step decline versus just a slope decline, if that makes sense.
Yeah.
And so you have an episode where they become symptomatic, they end up in the hospital, things look very bleak, and then they start recovering, but they don't necessarily recover to where they were previously. A little bit less, but they're still recovering. And that can continue over a length of time, course of time, where you start questioning every time you're making a decision. You think it may be close to the end, and all of a sudden they're doing better. And so, trying to having a healthcare professional like a community education rep from hospice help navigate some of those questions. You know, Hospice can step into that space as that decline's happening, but we have patients that improve all the time. They've had an event, they needed a little more support, they get that support and they actually start doing better. And that gets confusing too. But hospice can support patients in a way that helps them live their lives versus just having a great death. They have a great life until they're no longer with us. So it's a huge benefit. It's just knowing that that's available.
Okay, so I have 4 hours of questions for you. I hope that you had something to eat before we did the interview. Tell me, so when you're talking to the hospital staff, the assisted living staff, what are some guidelines that you might give them to look for or reasons and help them understand like what is the triggering thing that can put someone to reach out to hospice, ask the questions, and then get somebody set up. Give us some advice to our medical folks out there.
Absolutely. First things first, I think that education, information is always beneficial and helpful. And so I often will say, have an information visit. If there is a question at all, have someone come and talk to you, the patient, the family, answer the questions they have, because they will be able to give you information, even if you don't elect hospice at that time or it's not time yet. They can help connect you to resources that would support you. But to more specifically answer that question, things that we look for that indicate that there is a change in that disease process that would warrant getting hospice on board: increased hospitalizations, increased infections, and like I said, not quite bouncing back like they used to. Medicare has very specific guidelines for each disease process, but kind of in general, sleeping more, eating less, losing weight, not having the ability to do their activities of daily living as successfully as they were previously. So maybe they were taking a shower by themselves, but now they really need help, or they're not able to stand up in the shower. Now they need to sit on a chair. Things that show kind of an overall decline. Exactly. People will say they're just really weak. They just don't have the same strength that they had. Definitely weight loss is a huge factor because people aren't eating as much. They're not taking in as much nutrition. But those are kind of the biggest things. Definitely increased hospitalizations, infections, less time between each episode. Mom used to go to the hospital once a year, but now it feels like we're going once a month. Maybe not even that frequently, but those are things that are showing that that disease has progressed, and you might benefit from having additional support to help keep that person stable at home.
That was some really brilliant information, Kelly, and great advice for not only medical professionals, but also the family to start. Because that's one of the things the family is doing is they're noticing these things and they're going, hope against hope is, everything works out and they get better. And this end of life event is not coming like I thought maybe it was the first time they had a heart attack or something happened or they had a fall or whatever. I remember when my mom started telling me food doesn't taste good to me anymore. I don't like the taste of food. Come on, mom, you need to eat more. I'm not interested in food. I'm like, okay, that's a sign because she was a robust eater. She was like, what's the pudding tonight? She had a stroke and she was paralyzed. She was a quadriplegic. And so I would go at nights to feed her at the nursing home. And when she started saying, I'm not looking forward to the pudding,
Yeah.
I knew that was a sign. Now, what I find fascinating, so are you saying that if someone is a clinician, they're a doctor, they're a nurse, they're assisted living staff, that they can reach out to Heart Hospice in any one of the 4 states? Again,
Mhm.
especially, I'm very interested in getting the message to Michiganites, Michiganders. What are they called? So I'm not sure, but they can contact Heart Hospice and say, "Hey, do you have a community education representative
Mhm.
or someone that can come in and can meet with us and the family? The person is here in the hospital now. Could you come in and talk with us about so and so's situation?" Can they do that?
Absolutely.
Okay.
We call it a hospice 101, but it's just kind of the basic information. Um, Often that is what I do a majority of my
Yeah.
day. And
Okay.
so I will meet with the patient and family and find out, kind of like you said, what has been going on, what
Yeah.
changes have happened, what concerns do they have as you leave the hospital, what are you most worried about when you go home? And then as I get that information, I can share what my team does, how we support patients and families at home, and then answer questions that they have. If it's not time yet, if for some reason the goals don't align with what my team does, then I help figure out what other resources can be plugged in until it's time for hospice. I had a patient just call, was it yesterday, I guess? And I had originally spoken to them 3 months ago and had answered questions for them. It wasn't quite time yet. They've gone through therapy, they've gone through skilled nursing rehab, They've now gotten back in their home. It's been months, and they're recognizing that they didn't bounce back as much as they expected or wanted to. And so now they need additional support. They reached back out, and we got the mom on service yesterday. It's not something that once you have that conversation has to be activated right away. It can be, but it's always about taking in that information. As a physician, as a nurse, as a family, you want to know what your resources are and use them to your best advantage. What's going to help me live the best life possible? What's going to help my patients and families do the very best they can? Put those things in place. Oftentimes, hospice is the answer. It's just a matter of what's going to help them.
So you've put some words to this, which I've experienced personally with both of my parents passing on and my dad, who was in hospice for the last 6 weeks or so with aides at home. And I can tell that everybody listening, and even the nurses and doctors and anybody in a hospital, that being able to call, I just remembered her name, Nurse Mary, to be able, we're talking 30 plus years
It's
ago. Okay.
important. They make a valuable impact.
Oh man, Mary, like she was my angel, like I'd call her, like, what do I do? And she would guide me through and she would explain stuff. And I remember one time there was an argument between my father, who had emphysema and lung cancer, and my grandfather, who lived with them and was, obviously much older. They had an argument where my dad was like, you know, um, he didn't respond to me when I needed some help. And my dad went kind of crazy and was like, I want him to leave. I want him to get out. And I remember calling Nurse Mary and saying, well, how do I navigate this thing, and, calm my dad down. I had to tell my dad, Grandpa's not leaving. He's been living here for 25 years. He's not leaving, Dad. Go ahead.
I was going to say that's what I think the beauty of hospice is, that it is not one person that's helping you. There's an entire team. And so you have the nurse and you have the social worker and you have the chaplain and you have the aide, and they all provide a role for that family. And what you mentioned, I think family dynamics, I tell families there are pieces to this puzzle that you're trying to put together. And so the health factors, the diagnoses, that's all one piece of the puzzle. And then you have the financial piece and the financial burden of poor health and how that fits into your life. And one family member is very sick and needs all of this care that's going to cost this money. And then you have another family member who still has to live. I mean, there's so many pieces. In saying that, Medicare covers hospice at 100%. So that is kind of a blessing in and of itself. But those other pieces of healthcare that cost, and you're trying to navigate that. And then you have the sisters and cousins and everybody giving their 2 cents about what needs to happen, the frustration, the guilt, the caregiving burden. You love them tremendously, but it's hard to care for somebody 24/7. And letting a team come in and help at that time, it is invaluable. The relief and the support that you can get as a caregiver, as a family member. And so it's just, I don't think people truly understand the vast capacity that hospice has to help step in and help. When you hear the word hospice, a lot of times people think death, and they don't want any part of that. But when you list out what hospice does, the support with education, stepping into those spaces where you don't know, providing equipment that you need, a bed. I've been trying to get a bed for 2 years. We can get you a bed in 4 hours. Medicine support, explaining how to utilize those medicines, tapping into other resources, and utilizing the social worker to fill the gaps between what hospice does and what you need. All of those things are so, so profound. If I talk to someone and say, do you want hospice? They may say, no, I don't think we're ready for that yet. But if I say, if you had a team that did all of these things, they say, yes. How do I get that? That's hospice. And so you kind of look at, how do we shift the focus not to what hospice takes away, but what does hospice bring to the table? I think it is an amazing support system for patients and families when that time comes and they need it. For physicians who are getting phone calls repeatedly at their clinic for a family and they don't know how to step in and help, there's a team that can do that.
Okay, so you're dropping the knowledge bombs today, Kelly.
Sorry.
Ah, I love it. Yeah, it's great. I love that. There is a team of people that could give you answers, that can answer questions. It doesn't mean, okay, hospice, end of life, done. 2 weeks later, my loved one is gone. I remember, I think it was Dr. Brandon Hempel in Michigan. And I said to him, when I asked the nurse, how much time my dad had, she said something like, it's 5 to 7 days, that to the end. And now I've been dealing with this for a year, right? And like I felt like I had been punched in the stomach, the air went out of my body, and you would have thought I'd be a little more ready for that.
We're
But I
never.
but I wasn't,
We're
right?
not ready. We're
Oh,
never ready. And I do think that we also suffer from well-intended information that may not be accurate. And so when someone's like, how long do we have? There's that's we don't have a way to specifically give someone those prognoses. I have families all the time that are begging doctors for time frames, and it's
yeah,
it's hard to put a time frame on that. But I think when you look at hospice, you're looking, okay, what are the goals? Is the goal to keep this person stable and comfortable for whatever time we have? Then hospice. If the goal is to continue to seek aggressive treatments that may or may not be effective, not ready for hospice yet. But if the goal is comfort, stability, oftentimes in your own home, surrounded by your family, with your pets, that's what we want to step in and do, is help provide that stability and comfort, treating those symptoms at home instead of sitting in a sterile hospital room with nurses you don't know.
perfect, perfect. Okay, so Kelly, as we go to kind of land this episode, give us some words that the hospital staff, the doctor, the nurse might say to the family instead of call hospice, it's the end. Give us a little bit of a talk track. How could they approach and say that I'd like to put you in touch with the team and it doesn't mean the end? And it means that these people have incredible resources and everything from a chaplain to someone who can answer financial questions with Medicare, right? I'm saying it correctly. It's Medicare, not Medicaid.
Medicare covers hospice at 100%. Medicare is your medical insurance.
Right. So all of the ins and outs of Medicare and support. I love the story of I've been trying to get a bed for 2 years. Hospice helped me get a bed in 2 days. Like you sound like the super team. I remember some bed issues now that I
Mhm.
think about it. The bed issues and the oxygen issues they were not easy to navigate either. What can the physicians say to the family? What can the nurses say to let people think you should really talk to the community education representative or give a call to Heart Hospice and here, call this person?
Um, I guess I would start with, there comes a time in the disease process where the aggressive treatments that we are utilizing to help support someone, make them better, make them well, aren't as effective as they used to be. And so we can make a shift in focus to comfort and support instead of aggressively trying to remove this disease process. It's sometimes not even a possibility. And so when the goal becomes comfort and support, hospice is generally the team that you want on board. And so getting information from them, letting them answer your questions, explain the services they provide, it's an opportunity for you to utilize the resources that you've worked all your life for. You worked, paid into Medicare. When the time comes and you're ready to utilize those resources, you need to know about them. And so, even if it's not time yet, getting that information, having those conversations is important. Um, just gives you the opportunity to rein in everything that can support you. And so, as a physician, that's what I would do. As you start seeing them more often, I spend a lot of time in the hospital. You have those patients that you can see the increase of their visits to the hospital. And they were here last month and you talked to them. They were here 2 weeks ago and you talked to them. utilizing those resources and allowing them to have a team that supports them at home may prevent them from having to bounce in and out of the hospital for things that they could have done at home or even gotten ahead of. With a nurse coming once a week, instead of them getting an infection and not intervening for 4 or 5 days because they just think it's going to go away. Oh, it'll get better. It'll be fine. They end up in the ER. If the nurse had been coming by, they could have recognized that, maybe started intervention sooner and prevented that episode from happening. And so, as a physician, as a clinician in any environment, at the point where those aggressive treatments aren't maybe as effective as we would want them to be, we look at another option. It's not treating, it's just a different focus.
Yeah, that's some really good stuff. I want everybody, every clinician, every doctor, every nurse, every hospital, assisted living staff. This is a great move. Do you like go and make visits when you're in the hospital or you're in the doctor's office? Are you like handing out cards? Are you like, call me, any questions? And here's a bunch of cards that you could hand to somebody and say, here, have them call me and I will answer questions. I'm the education representative. Is that how it usually happens?
Yes, that is one way.
Right.
I visit with doctors' offices, staff, have left my cards. I had a physician that gave my number to a family not too long ago, and the questions they had were more custodial care specific. They needed help, but they
Yeah.
weren't quite ready for hospice. But I was able to help guide them in the right direction. I also am, at the hospital where they've put that consult in, have hospice come talk to them. And I go in and do that initial visit with the patient, the family, answering questions and explaining what our team does and how we work. And if it's a good fit, if it seems like it would be something that would be helpful for them, then I help get that set up.
Right. And as I'm getting to learn more about Heart to Heart Hospice in the 4 different states, does every state or area have the version of a Kelly Hampton, a community education representative?
Absolutely. There is a Kelly everywhere.
There's your book. There's your first. There's
There's
the
a
book
Kelly
that you will
everywhere.
write. There's a Kelly everywhere. My 29 years in hospice and the book that becomes a national bestseller and you retire on
Exactly.
and you go live in Spain or something. So I like it. I like it. Well, this has been a really, really informative, really great call. You really have dropped the knowledge bombs, as the kids would say, on us today. And I would love for anybody, especially someone in the medical profession, to reach out to Heart Hospice in Michigan and any of the other. I got the states right: Oklahoma, Indiana, Texas. Those are your
Correct.
those are your 4 places. The largest privately held hospice organization in the country, right?
Yes, sir.
Yeah. Go ahead.
There are a lot of options for hospice, I will say. And in certain areas, it works differently. I know in the Metroplex Fort Worth area, there are over 300 hospices. There are tons of options. I think the thing that I love the most about Heart to Heart specifically is their willingness to think outside of the box and really meet patients and families where they are. And so when you look at why hospice, why now, we're really looking at what things are going to help improve your life and how do we help step into that space. And so, having worked in this industry for a long time, I think Heart to Heart is just an amazing way of meeting patients and families where they are. And it's not a cookie cutter service. There are guidelines that Medicare sets up. So we obviously function within those guidelines, but then it's how do we help meet your needs? How do we help take care of your family? And that can look different from patient to patient.
Yeah. Very well said. Very well said. As we go to end our episode, we usually like to ask our guests, Kelly, to tell us something a little personal about themselves. I like to say that I find that very extraordinary people live fairly ordinary lives. I wrote a book about my parents a few years ago called The Durkins, and I wrote 50,000 pages on my parents, a lot about my dad. He was a great man. But as I realized how extraordinary they were, I was talking about very ordinary, camping trips and
Mhm.
things like that. So we don't need any James Bond kind of stuff from you, but tell us a little bit about Kelly Hampton's personal life.
Oh, I just read a book recently. I'm in a book club. We meet once a month and we've been meeting for 13 years now. And it was a very interesting book, but one of the things from the book that stuck with me or resonated with me is um, people die how they live. And when I think about what I do every day and I help people navigate this end of life space that can be very difficult, I want my life to be full of life in addition to helping people navigate. So, things I enjoy, I have a wonderful family. We live on a farm with cows and live out in the country, very peaceful, simple, quiet. Girlfriends that I just adore, a church that I am very proud to be a part of, wonderful family, live very close to my parents. It's important that I'm there to help care for them as they get older and start having more challenges. And so we live close to my in laws and my parents, actually. Like to hike, like to spend time outdoors. It's just really want to be intentional about how I live my life. And that's something that you have to really think about every day. Days go by quickly. And if you're not intentional with your time, you can look back and see you missed some things. And I don't ever want to do that. So,
To quote the very famous philosopher Matthew Broderick as Ferris Bueller, he said, life moves pretty fast.
mhm.
And if you don't stop to look around, you might miss some of it.
It's true. And you don't even think as the days go by, you think, I just got to get through today. I got to get through today. And then all of a sudden, years have flown by. And so it goes back to Ferris.
Yeah, it all goes back to Ferris, or maybe, 6,000 years ago, the scripture says life is like a vapor,
Mhm.
right? Life is like a mist. Life is like a
Mhm.
mist. Whew.
Here
It's
today and gone tomorrow.
here
It's
today,
true.
gone tomorrow. I love your, what did you say? Why hospice? Why now? I think that might be the title of this episode. Kelly Hampton, community education representative for Heart to Heart Hospice. Really appreciate you being here today. Thank you so much for sharing your wisdom with us.
Absolutely.
So, to all of our listeners, let us say that we really appreciate you listening to the Heart to Heart podcast. If you are a listener, could you do us a couple of favors? Give us a 5-star rating. Your Apple Podcast, Spotify will ask you for a rating. Please give us 5 stars. If you want to give us less than 5 stars, then don't give us a rating. Honestly. But these are great interviews, and also if you could write a review for us about how much you've enjoyed them and how much they've helped you, that would be very helpful. I know that's a big ask for people to sit there for 5 minutes and figure out how to do a review, but you can Google how to do a review on Apple Podcasts, or I always watch YouTube videos on how to do this stuff technically that I can't figure out on my own. And then the other thing is that if you could share the episode, on all podcast services, there's 3 little dots and you can share it. And you could share it with your coworkers. You could share it within the Heart to Heart Hospice community. You could send it to your coworkers and say, "Hey, listen to this great episode that Kelly Hampton just did." But certainly, those of you that are in the public, my wife just sent an episode of the Heart to Heart Hospice podcast to a friend of hers whose son had passed away recently. And she said, my husband, she knows MJ, my husband and Dr. Brandon talk about grief. And she said, I think that the discussion about the witnessing of grief would be very helpful for you. And so she forwarded the Heart to Heart Hospice podcast to her friend who had nothing to do with hospice, but had a loss, and it was a serious loss, a 34-year-old son, and she's going through it. So to hear some good, solid talk about, Dr. Brandon says, I go down in the pit with people and I sit with them and I witness. And he talked about how important it was to witness. So anybody that is in this stage of life, dealing with loss and grief and heartbreak, it's great to hear some people from Heart to Heart Hospice that have the wisdom and the education to help you. Thanks everybody for listening, and we'll see you on the next episode of the Heart to Heart Hospice podcast.
That concludes this episode of the Heart to Heart Hospice podcast. Be sure to check back regularly for new episodes and get connected to our guiding principles and our commitment to patient-centered care. We'll see you on the next episode.